Good morning. I am Alize Asker, and today I would like to share an interesting case of Serratia endocarditis from intravenous drug use. Serratia marcescens is a gram-negative coccobacillus that is typically found in water and soil. It is commonly associated with respiratory, genitourinary, and wound infections. It is also an uncommon but potentially fatal cause of infective endocarditis. Serratia endocarditis is seen more commonly among immunocompromised individuals, intravenous drug users, and those with prosthetic valves. Since infective endocarditis from Serratia is so rare, there is not enough evidence to determine the appropriate treatment, and several different drug combinations have been reported in literature with varied success. Moreover, the theoretical possibility of AMP-C-mediated drug resistance makes it even more difficult to determine the best treatment strategy for this organism. We present the case of a 47-year-old gentleman who recently underwent tricuspid valve replacement for MSSA endocarditis, who presented with subjective fevers and unilateral visual loss for the past week. Further evaluation revealed that the patient had been injecting heroin intravenously, and he admitted to increased intravenous drug use due to multiple social stressors, including the ongoing pandemic. On presentation, the patient was hypotensive, hypoxic, and had diffuse corneal edema in his right eye. His blood tests were significant for thrombocytopenia with a platelet count of 8,000 and acute kidney injury with a creatinine of 1.9. Imaging showed numerous septic emboli in the patient's lungs, as shown in image 1, as well as emboli in his spleen and his brain. The patient also underwent an echocardiogram which revealed thickened tricuspid valve leaflets with mobile structures projecting into the right ventricle, as shown in image 2, raising concern for vegetation. The patient was empirically treated with ceftriaxone while awaiting cultural and antimicrobial sensitivity results. He was eventually diagnosed with bioprosthetic tricuspid valve endocarditis and endophthalmitis from Serratia marcescens, with resistance against penicillins and first and second generation cephalosporins. At this point, given no significant improvement in the patient's clinical course, he was switched to cefepime. However, the patient continued to deteriorate and eventually developed multi-organ failure and expired. Intravenous drug use poses serious risk for infection with potentially devastating consequences, as seen in this case. With the ongoing pandemic, we are seeing more cases of intravenous drug use, with over 1 in 10 adults reporting increased drug use, according to CDC. Serratia endocarditis is typically seen among intravenous drug users and is associated with a mortality rate as high as 68%. There is insufficient data to determine the optimal treatment for Serratia endocarditis. Many organisms, including Serratia, have been shown to have an AMP-C-mediated increase in the production of beta-lactamases, which makes them immune to most penicillins and first, second, and third generation cephalosporins. Studies have shown favorable outcomes with the use of carbapenems and cefepime for such organisms.